Many patients ask me, what should I expect with cataract surgery? Starting from the beginning, you'll show up to Georgia Eye in our clinic here, and you'll check in. We'll ask you for some paperwork to be filled out. Even existing patients who used to be here with Dr. Crosby, a lot of times there's new information that we have to put into the computer, so it may take a few minutes for that. The technician will take you back, and really that's when your eye exam starts. Our technicians are trained to get accurate measurements. They're going to take you to a diagnostic machine that'll measure the length of your eye. It also measures how powerful your cornea is, and takes several other measurements that are critical to coming up with the correct power of lens we place inside your eye during cataract surgery. They'll ask you some questions about your medical history and go through simple things like allergies, are you taking any medications, and things like that. Ultimately, you'll end up speaking with me, and we'll do a thorough eye exam. And really what I'm looking for there is just to make sure that there's nothing else with the eye or the visual system that could be also interfering with the vision. See, a lot of people, when they hear that they have poor vision or they might have cataract, I think that's the only thing that can cause vision loss. And that's not always the case. And so that's why it's important to go to someone who can accurately diagnose other eye disease so that we don't end up doing cataract surgery and turns out that maybe they had retinal disease or something else that causes poor vision. So during the eye exam, I'm looking for everything, not just cataracts. But I do want to know what type of cataract you have, and I'm looking for any other problems that may arise during surgery that could affect your outcome. At that point, after the eye exam, we'll have the discussion that talks a little bit about the risks and benefits of cataract surgery. The main thing that patients need to understand is that cataracts, everyone gets them. It's kind of part of life. However, not everyone needs cataract surgery. There are some patients who need good vision. Maybe they're working, they're still very active, and their cataracts are interfering with their activities of daily living, and in which case that's a situation where they might want cataract surgery sooner. Then there's patients who aren't quite as active, who don't have the higher visual requirements, and maybe they should wait a little bit on their cataract surgery. So it's a little bit different. A lot of that comes out during our discussion after the exam. But essentially, after I talk about the risks and benefits of cataract surgery, we're going to go over different lenses. Nowadays, cataract surgery, with all the technology and how everything has evolved, it's really gotten to a point, it's kind of like buying a car. You can get the leather seats, you can get the sunroof, you can get the Chevy, or you can get the Cadillac, or the Toyota, or the Lexus. So, with cataract surgery, there's lots of different lens options. There's lens options that give you good distance vision, good intermediate vision, good near vision. There's lens options that do that, but also plus correcting astigmatism, which is a whole nother discussion. A lot of times patients might say, all I'm interested in is what my insurance covers, and that's okay too. That's called a monofocal lens, which is a good option for a lot of patients. But essentially, that discussion between the doctors is an opportunity for me to build rapport with the patient, to let them know that they're in good hands, that I understand what they're going through and understand how to get them better, and we come up with a plan together. And then at that point, they'll move on and talk with my surgical scheduler. They'll go over some paperwork. I have to have permission to do a surgery, so I have to have their permission, so there'll be some consents and paperwork that they need to sign. But ultimately, they come up with a date. From that moment on, the wheels are in motion. During cataract surgery, they're most likely going to have you show up about an hour early or so, maybe more, to the surgery center so they can get you ready, fill out paperwork. Their goal is to get you very comfortable and start the dilation process, because your eye has to be completely dilated for cataract surgery. They'll usually go into the pre-op area, they'll make you very comfortable, they'll start giving you the dilation drops, and usually your family member's there with you at that stage. And then you'll see me before surgery. We'll talk a little bit about the plan. I'll give you a little mark above the eye that we're doing, and then we'll roll you back into the surgery. At this point, most people have already had some medications on board, so the anesthesiologist will come by and give them a little bit of medicine to help them relax and calm them down. And so a lot of times patients don't remember this part, because a lot of times the medications kind of knock them out. But our goal is not to put you completely under, actually, because making you very comfortable, making you sleepy is actually a lot safer than general anesthesia. It's a lot easier on the heart. So we give the medications to make you comfortable and take you back to the operating room, and at which point we'll begin the case. You'll see a very bright light. You may hear me talking to the nurses and instructing them different instruments to hand me. You might see some shadows moving around as we're performing the surgery, but ultimately the surgery itself will probably take somewhere around 10 minutes or so. Afterwards, the light goes away. We'll place a small patch on the eye and we'll take you back to the recovery room. At this time, you'll be reunited with your family, and the nurse will likely be going over all the instructions for after surgery with you and your family members. And so a lot of those instructions, the big things is obviously we don't want you rubbing your eye, but also no heavy lifting, no bending over or straining that may cause pressure on the eye. We really want that eye just to be kind of nice and calm. You'll also have some post-operative drops that will be given to you that you'll pick up from the pharmacy, and you'll be instructed on how to take those. But usually that day we want you to go home, relax, maybe take a nap, and just enjoy having been done with the cataract surgery. Usually the next day we'll see you for your post-operative visit. We'll bring you into the office, and we're looking to make sure that the eye pressure is okay, that your vision's doing okay, and that everything went successfully. At that moment is usually when we check your vision again, and a lot of times that's pretty surprising for people how much better their vision has gotten that next day. But in a nutshell, that's the cataract surgery. That's what you might expect from start to finish.